thank you, gentlemen, for joining us here at the Global Health Forum 2025. I believe that we've already set up many of the big themes that we can continue to unpack. And one particular issue that we didn't get a chance to delve into further in the earlier discussions was funding, investments, how we can have effective funding and investments across the healthcare ecosystem. But before we do so, I'm going to ensure that we all here in our audience, because we have a wonderful mix of international representatives as well as representatives here in the UAE, know about you both and the organizations you represent. I'm going to start with yourself with a slight bias. I live in Abu Dhabi, so Cleveland Clinic Abu Dhabi, celebrating the 10th anniversary. Dr. George, can you please give us an insight into this world-class facility? And also yourself, you are a pioneering robotic surgeon.
Thank you. Thank you for having me here today. And thank you for the shootout. So Cleveland Clinic Abu Dhabi started as a vision more than 10 years ago by Sheikh Mohammed, who wanted to bring world-class care closer to home, to the people of the UAE and the region. So fast forward, in March we'll be celebrating our 10-year anniversary. Cleveland Clinic Abu Dhabi is seeing around over 1 million patients a year now, doing 25,000 surgery, attracting more than 10,000 patients from abroad. The focus is mainly on complex surgery, so transplants. So we've performed over 750 transplant, heart transplant, lung transplant. And the focus going in the next decade is to focus on attracting the best talent and training the best talent going into the future. In addition to this, big investment into innovation, in particular technology, AI, robotics, and so on. So I like to say that what Cleveland Clinic, it took Cleveland Clinic 100 years to do what they did in the US. It took 10 years for Cleveland Clinic Abu Dhabi to reach the level and the quality of care that is being provided.
And that's a remarkable achievement. And as you say, the really big focus is on transplants. It's the future of healthcare here and attracting best talent, which builds on the previous panel discussion. Dr. Seth, welcome back to the Global Health Forum. We were on stage together last year. You, of course, are the Senior Health Advisor for SICPA and formerly the CEO of Gavi and the Vaccines Alliance. Give us an insight for our audience here in terms of the organizations you're with and your particular background here.
So thank you so much, and it's great to be with you all again. SICPA is a privately held Swiss company, close to 100 years now. You may not know the company, but you know its product. It makes security inks for banknotes and for passports, and is used in all countries of the world, except maybe North Korea. So it's commonly used products. The owner, of course, realized that banknotes may not be the future and has diversified. And a few of the areas they've diversified into have been health taxes, excise taxes, an important issue for most countries. The way to control chronic diseases is to try to make them less affordable, and this also helps with some of the financial crises that countries have, but also creating surveillance systems for countries, including wastewater, aircraft wastewater, to be able to look for what will be the inevitable next pandemic, as well as the pandemic of antimicrobial resistance that exists throughout the world.
So that somber note there on a very illustrious background, the next inevitable pandemic. So that really focuses our mind. If we speak about effective investments in global healthcare, where should the finances be focused? If I start with you, Dr. Seth, and bring in you, Dr. George.
So if you look at the healthcare systems of most countries throughout the world, 75 to 80% of the healthcare can be given at primary healthcare level. So the challenge is to focus on building strong primary healthcare systems so you free up the rest of the resources for secondary and tertiary and beyond. The challenge in doing that is having a high quality primary healthcare. And as we think about that, there was a recent commission, Lancet Commission for Global Health by 2050, and the concept that they talk about is progressive universalism. So a very poor country country starts with the most cost-effective interventions they can do. As you get wealthier, you add on until you get as comprehensive a system as you can. And you can get about 80% of your benefits treating 15 common conditions, about half infectious disease and half chronic disease. So that's really the agenda one has to do. We heard in the last panel about the crisis in health workers, and what that really entails is now using technology to empower less qualified healthcare workers. Not everybody needs to go to a specialty doctor. We can get care with community health workers. We can get care through nurses, particularly if they're enabled with new tools that allow them to use algorithms and others to know when they can treat and when they can refer.
And that's such an intriguing term, progressive universalism. It's a really good way for us to focus our minds. You seamlessly allow me to bring in Dr. George. You spoke of leveraging technology. Dr. George, what's happening at the Cleveland Clinic Abu Dhabi, and what could be applied more universally?
I mean, we as we just heard and we heard from the previous panel, the population is aging. The demand for healthcare is increasing, and there is disparities on who have access to care. What we are hoping is we can leverage technology to improve access to care, and what I like to say is democratize healthcare, democratize surgery. And I'm going to give you an example how we can do this. We've heard a lot about, for example, how we can diagnose diabetic retinopathy, breast cancer screening using AI. I'm going to give you another example of how we can leverage high level of expertise to do surgery, and this is remote surgery. So 10 days ago, we performed the first remote surgery between Ohio and Abu Dhabi. Surgeon was in Ohio, the patient was in Abu Dhabi, and we're able to perform the surgery. So what does that mean, and what are those implications?
And what type of surgery was it?
So this was a prostate cancer ablation on a patient who was here. So this is a groundbreaking step. It's not just about, we could have done it from here, but what we wanted to show is we can have access to high level of expertise. I want you to think a little bit forward. What we can do now, we can place robots across different countries, Africa, Southeast Asia, and have a command center, for example, at Cleveland Clinic Abu Dhabi, and have access to a high level of expertise to do remote surgery. So this is how we can leverage the decrease in the no access to healthcare anymore, or highly skilled healthcare provider, is by leveraging technology and democratizing surgery. So I'm very excited how we can leverage it going to the future.
And that is certainly a groundbreaking technique. So I'm really pleased that you've given us that spotlight on the example. Drawing on your own personal background as a pioneering robotic surgeon, in your career, you must have seen the advancements that we're witnessing today as revolutionary. Please share your kind of first-hand experience as well.
Yeah, I think I just want to take a step back and say what robotic surgery, a lot of people think when we say robotic surgery, it's fully automated surgery. So in fact, usually traditional surgery is we make a big incision, for example, in the abdomen to access the organs. Robotic surgery, what we can do is we can make small incisions, and then we put instruments in, and then the surgeon sits at the console. But the surgeon is still performing the surgery. So any movement I will do with my hands or with the tip of my fingers will be reproduced inside of the abdomen through small incisions. So what this allows us to do is to perform surgery with less blood loss, be more precise, less manipulation of tissue, so quicker recovery, less risk of infection, and so on. But this also allows us now to leverage more technology like AI to start improving on automation and getting to, right now we have a level 2 of automation, but get to a level 5 of automation where we can ask the robot to do tasks for us. And by leveraging this, we can, again, I like the word of democratizing surgery because I just don't feel it is right that surgery is only for the countries that can have access to high technology such as robot. But when we start doing this and democratizing this, everyone can have access, and this will decrease inequities.
And decreasing inequities is certainly a big focus of your work as well, Dr. Seth, in terms of addressing the healthcare disparities around the world. When it comes to focusing our minds in terms of where the investment should be focused, I know there was an intriguing study that you shared with me off stage about the projection for 2050. Please share that with our audience.
Well, one of the interesting parts of that commission report was that you can, with careful investment, see a world where we can reduce preventable deaths by 50% by 2050.
Which is a shockingly high number and an inspiring number.
Yes, and that's what we want to be able to do. Up until now, you can look at countries that have invested carefully and see that type of change. So places as diverse as China, which one might expect, but Ethiopia or South Korea, Vietnam have been able to make those types of reductions, albeit from some of those from poor health statistics in the past. And the challenge really is this very careful focusing on the priority areas where health is challenged in these countries, using the resources most cost effectively, and going through this process of progressive universalism to be able to do this. My own area, of course, is vaccines, and getting everybody, as close as you can to everybody vaccinated is critical, because for every dollar you invest in vaccine, you get a $54 return. And so this is obviously a very, very good use of finances, and it's making sure that countries are having that type of view to what they do with their resources.
And that's certainly a very inspiring vision, thinking about 2050. Dr. George, to bring yourself in on that, you mentioned earlier about the aging population. What's your thoughts on what Dr. Seth had just said?
So for someone like me who's on the side of provision of care, I'm very worried about this, because what does that mean? There's another study that says by 2050, the number of people that are of the age of 65 or more is going to double. The more the population age, the more they need access to health care. Right now, and we saw it with the COVID-19 pandemic and how we're struggling to get out of it, we are not ready for this. And I know there is a lot of highly influential people here. If there is a call to action, we need workforce. We need to attract talent to healthcare to be able to help those patients that are, going to be aging. And we know we cannot. There is not enough people to care for those patients. So it is a moral imperative for us to leverage technology. We have the technology. We need to fast track the adoption of this technology so we can help all those patients. Otherwise, we do have a problem at hand. I'm lucky to be working now in Abu Dhabi, and we have regulators that are very forward-thinking regulators. And I would really encourage everyone who's on the regulator side to do the same and push the boundaries so we can adopt those technologies and help as many patients as we can.
So technology could be one solution to addressing the workforce challenges. Dr. Seth, your thoughts?
Well, first of all, we need technology. I'm a technologist, and I think most of the people here in the audience appreciate the importance of technology. But as we deal with this tsunami of aging, if I want to call it that we're going to see, what we're looking for is not necessarily, of course, we all want to live long lives, not necessarily lifespan. What we're looking for is health span. What you don't want to do is live an additional 10 or 15 years, but have those 10 or 15 years be, with severe morbidity and not able to function well. So what we need to do is focus the population on that, and that is going to be about prevention. Some of that will be high-tech. We're beginning to understand the molecular basis of aging, and we can intervene on that. But at the same time, some of it are common things. It's going to be, tobacco is the new tobacco. No smoking. It's going to be regular exercise. It's going to be a healthy diet and dealing with weight. It's going to be dealing with chronic diseases in a prevention strategy and keeping the mind active. These are all, common sense, easy technologies. But if we don't do that, we're going to be in a world where we're going to have this tsunami of not aging, but of unhealthy old people who are really going to break the system. And so this becomes a really important priority for us.
I like the way you put that. You said rather than lifespan, it's health span, and it's all about prevention. I know with Cleveland Clinic, with M42, prevention and precision predictive healthcare is, a major focus. Focusing back on the theme of the session, financing and investments in healthcare, are the finances directed to the right places when it comes to prevention? First yourself, Dr. Seth, and then Dr. George.
So first of all, the answer is no, and that's true, I think, in most countries of the world. I mean, if I look at my own country, the United States, they rated themselves, or they were rated by the WHO 46th in health outcomes, despite the fact that they spend almost 3 times what most countries in the world do on their health care. So we're not doing so well with the use of that finance. But also, as we think about prevention, we need to use innovative financing mechanisms. I'll give you an example. So when COVID hit, I was CEO of Gavi, as you mentioned, and we knew that there would not be equitable distribution of vaccines. There hadn't been in the previous pandemic, so we decided to set up COVAX to try to improve on that, which we ultimately did, although it certainly wasn't perfect by any means. But we had zero money, we had zero workforce, and we had to get started. What's happened since is an innovative financing mechanism that allows a 0-day facility. So there's $500 million put aside by the global community to spend, but then there are funds from the Development Finance Corporation, the European Investment Bank, others who can then scale up that money. So within a short period of time, you can have about $2 billion available to begin to roll out interventions that might be necessary for a pandemic. That's not enough, of course. In COVAX, we ultimately used $12.5 billion. But the issue is to start right away trying to make sure there's access, whether it's vaccines or treatments or better diagnostics, et cetera. So we need to be thinking about not just is there adequate finance, but is it in the right place at the right times for the interventions that we need.
And I think those are really astute points you make. Dr. George, you, of course, have been on the front line, if I may say, in those terms, as a robotic surgeon and now a CEO. Are the finances in the right place? Are they directed in the right place when it comes to prevention?
I think there is more and more attention about prevention, which is great. We didn't have this before. It was more focused on a fee for service, where the hospitals are being paid for the procedure they are doing, and it was the financing was not with the right incentives, if you want. So we're incentivized to do more procedures, seeing more patients. And now I think there is a much bigger attention right after COVID to go into prevention. But we still have ways to go. I mean, for example, GLP-1, Ozempic, Mounjaro, we know that it decreases obesity, but we know that obesity is also associated with cardiac risk factors, cancer. It would be good to have more investment and make it a much cheaper drug so everybody can benefit for it. So we can prevent obesity, we can prevent cancer, we can prevent cardiac. There is things we can do in the short term. So funding of prevention is important. It's not the only solution, because at some point we also need to treat. But we need to leverage other financing, not just government. There's crowdfunding for good ideas that are just need to take the last step to get into a trial. There is venture philanthropy that we can leverage. There is other mechanism and vehicles that we can leverage to not only do prevention, that is very important, but also do screening, treatment, and so on, precision medicine and so on.
Absolutely. And on the point of prevention and those obesity drugs, surely the vision in the future is actually to empower people to be making the lifestyle choices if they don't even need to rely on any drug, because of course every treatment does have its risks associated as well. Dr. Seth, I'm going to allow you both to do a call to action. So just, did you want to come in on a point?
Yeah, I just wanted to make a point, because, Dr. George already made this, but I want to be more explicit about it. If you look at what Gavi was able to do, why was it able to bring vaccines, to the world, 750 launches of new vaccines across the world, it was about putting together the demand. So at the end, if you look at the cost of the 11 vaccines that WHO recommends, it's about $1,300 in the US. Gavi is able to provide it for $24. I mean, that's a 98% reduction in price. And that's about paying attention to having high-quality products at a reasonable cost available for the masses. And I think this is what we need to be thinking about as we have new preventive interventions that can be there. How do we make those available at a reasonable cost so they can get as wide use as possible, again, so the resources can be used most effectively?
I'm going to make that your call to action. That's going to be the price point has to be part of the overall initiative in terms of investments and financing. Dr. George, if I may give you the final word, when it comes to a call to action, what might be something that we should focus our minds on?
You know, we're at the crossroads right now with technology, and if there is one aspect, I already did my call to action earlier on, I will just say it again, is fast track the adoption of technology. It is very important so we don't get into a crisis that we've already heard the previous panel talking about. The workforce shortage is going to continue to aggravate. The quick solution is fast tracking the use of technologies.
It was such an urgent call to action. We had to hear it twice. Yes. And we, of course, would like to double the time that we have with you both, but it's just beholden on me to say, please do return to the Global Health Forum. It's been wonderful to have you with us here today. Dr. George, Dr. Seth, my esteemed audience, please give them a big round of applause. Thank you.